Do you get sciatica pain behind the knee when standing or walking for long periods of time? If so, this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to give you 5 quick fixes for sciatica pain behind the knee, plus 5 exercises that you can use to get long-term relief. And the good news is you can do them in just minutes per day. So first of all, how do you know if the pain you're having behind your knee is actually from sciatica and not from something else? After all, stiff calf muscles or hamstring muscles, meniscus tears, Baker's cysts can all cause pain behind your knee. But the tips in this video are specifically for sciatica pain. So some symptoms that may indicate that you're having sciatica pain behind your knee are if you have a shooting pain that radiates from your butt down to your knee, or from your knee that seems to shoot upwards. Or if you have numbness or tingling in your legs, or if you have a history of back pain or buttock pain, particularly on the same side. Those are all possible indications that you may have sciatica. But there's also a test that you can do for it to tell if your pain's coming from your nerves, and this test leads directly into the first treatment. So the test is called the slump test. And it's called that because you sit in the chair in kind of a slumped over position like this. Then you clasp your hands behind your back and bring your chin down towards your chest. Now you raise one leg up, particularly the symptomatic leg, the side you're having trouble with, just up until the point where you feel symptoms. Now if you can straighten your knee all the way and that doesn't cause you any pain, then pull your toes up towards you. Then wherever you start having pain during this test, you want to lift your head upwards. And if that changes your pain, particularly if it makes it better, that's a good indication that your nerves are involved, because your calf muscles and your hamstrings don't attach to your head. But your nervous system is continuous from your head all the way down to the tips of your toes. And so if you get a positive slump test, that's a good indication that your pain may be coming from your nerves. So how do you treat it? Well, I mentioned that the first quick fix is very much like the test. So you want to get over in that slump test position like this, and then straighten one leg up just to the point where you start having symptoms, and then bring it back down. Now there are a couple different ways that you can do these nerve glides. You can do what's called a slider, where you move your head up at the same time as you bring your foot up, and vice versa. And supposedly that's a less aggressive version because you're really just kind of sliding the nerve like dental floss through your spine and through your leg without adding tension to it. But if you also happen to have some neck pain or you get dizzy when you look up, that may not be the best option for you. So another alternative that works pretty well is just moving the leg without moving the head. This is referred to as a tensioner. It does put a little more tension on your nerves, but really the reason that these treatments work is that they get your nerves to move. And your nerves need 3 things to be healthy. They need space to move, so they can't be pinched or compressed. They need movement, and they need blood flow. And when you do nerve glides, you get that movement and blood flow. But what do you do if the nerve is compressed somewhere? Well, that's what the other 4 treatments are going to address. Now, since we are talking about sciatic nerve pain at your knee, I'm going to first address the local things, the areas where it could be compressed that are close to the knee. So the first one is that your sciatic nerve runs down the back of your leg, and it kind of splits into 2 branches. A fibular branch, which goes along the outer side, and then a tibial branch, which goes right down the back of the knee and then back of the calf. Now, one area where one of those branches can get compressed is behind a joint called the proximal tibiofibular joint. It's where the small bone in your lower leg, the fibula, joins with the big bone, the tibia. And if that joint isn't moving properly, it can compress on that fibular or peroneal branch of the sciatic nerve. Now, in the best case scenario, that joint doesn't move very much to begin with. So it's really hard to test it on yourself to see if it moves, but fortunately the treatment is pretty easy and there's not a lot of risk if you don't have the problem. So in this case, the treatment is actually the test. So to do that, you can take a rolled up towel like this, and just wedge it behind your knee. You can do this sitting in a chair, you can do it laying down. You want to make sure you get that towel wedged in behind your knee. You may need to adjust the thickness, so unrolling it or rolling it so that it kind of stays in there and doesn't slip out. You want to get it in as deep as possible so it's right behind that fibular head. Then grab on your shin with your hands and pull your knee into as much bend as you can comfortably. What this does is it uses the towel to push that fibular head back forwards. And so if it's stuck and not moving properly, this will help get it moving. Now, if it's not stuck in the first place, it's probably not going to cause you a lot of additional problems. So if you feel better after doing this, that may have been the problem to begin with. If you don't feel better, then you're probably not going to feel worse. Now, moving on to the other branch, the tibial branch that runs down the back of the knee, that runs right through the soft spot in the back of the knee, right back here. It's called the popliteal fossa. And there are a lot of things that run through that area: your nerves, your arteries, your veins, your calf muscles and hamstrings kind of cross in that area. And there's a well-known acupressure or acupuncture point back there called the bladder 40 point or the urinary bladder 40 point. And putting pressure right on that area that's right over the tibial nerve can oftentimes help relieve sciatica. Now you want to hold that for about 1.5 to 2 minutes, and it should be a very gentle pressure. You don't want to dig in there as hard as you can because you're probably just going to irritate the nerve even more. So you can take your fingers, just kind of dig them in behind the knee like that, and put a little bit of gentle pressure back there. Again, hold that for about 1.5 to 2 minutes. Then reassess afterwards. You can try doing that slump test again, or just get up and walk around and see how you feel. Now, if you want an on-the-go option, there are also braces that you can use where you take a band. This is called the sciatica relief band. You put it behind your knee, you strap it around like that, just tight enough that it doesn't slide down. You don't want to put too much pressure to the point where it's painful. And then it puts pressure right on that bladder 40 point in the back of the knee, and it can help make it a little bit more comfortable when you're up and moving and walking around. So the next option is still for the tibial branch, but further down in the calf. And if your calves are stiff, which many people's are these days, since we're largely more sedentary than we used to be hundreds of years ago, if you have stiffness in your calves, that can adhere to the tibial nerve down lower in your calf. And so to get that moving, you can use a rolling pin, either a muscle massage stick like this or just a regular baking rolling pin. You can use a foam roller as well, although I think a rolling pin works better for this purpose. And just kind of move it up and down your calf like this. Your calf muscles are pretty big, so go all the way to the inside, straight down the back, and then to the outer side. If you happen to notice an area that's a little bit more tender, spend a little bit of extra time there. Again, you don't need to put so much pressure that you're causing yourself pain, but just enough to get some of those knots relaxed a little bit. Now, ultimately, you will want to stretch your calves out, and we'll get to that a little bit later in this video. Now, finally, what about using a foam roller? A common treatment that people use is to foam roll their hamstrings or over their sciatic nerve, but that oftentimes just flares things up. If your nerves are already irritated and you put pressure on that area, it just gets the irritated nerve a little bit more irritated. But there are some good things that you can do with foam rollers that can help if you have a sciatic nerve problem that's causing the pain behind your knee. Now, to do that, you don't actually treat the area that hurts. You work on the areas that don't hurt. Remember that your nervous system is continuous from your head all the way down to your toes. And so that means it runs through your upper and lower back. And using a foam roller on your upper back is actually a really good way to loosen up that upper back. There's also your sympathetic nervous system or your fight or flight system runs through the thoracic spine. And oftentimes it just feels good to get that area moving a little bit better. You may hear or feel a few pops when you're doing this, which often does feel good in itself. That's not really the purpose, but a lot of people do get those as they're rolling their spine. So you want to roll from your shoulder blades down to about the point where your back starts to dip in. It's not usually a good idea to go all the way down here because that just arches your lower back more and oftentimes hurts. So stay in the convex area of your spine or the thoracic spine, the upper and middle back, and just roll back and forth. Now, another advantage to doing that type of exercise is that it helps your thoracic spine to extend a little bit more. And if your thoracic spine is slumped over like this, then when you stand and walk, if you don't want to look down at the floor, you've got to straighten yourself up somehow. And that comes from arching at the lower back. And that brings us on to some of the longer term strategies for getting your sciatic nerve to stop hurting. Because if you do tend to stand and walk with your back arched like this, that narrows the space where the nerve roots to your sciatic nerve come out of your lower back. And when those nerve roots get pinched, that can start to refer pain down further into your leg. And so to decrease the arch in your lower back when you're standing, it is helpful to straighten up through the upper back so that you don't have to bend so much through the lower back. But you also want to kind of roll your pelvis underneath of you like this. Just do a little pelvic tilt where you flatten the lower back out. So go from a position like that where you're really arched to a position like that where you're a little bit more flattened. Now, if you are someone who tends to stand in a lot of back arch like this, when you do that pelvic tilt and get yourself aligned more normally, it's probably going to feel like you're really, really badly slouched over like this. In reality, you're probably not. It's just not what you're used to. So again, tuck the pelvis underneath of you and then hold that position. Now, you don't necessarily need to do that as an exercise. Just do it when you are standing for longer periods of time. For example, if you're doing dishes or cooking in the kitchen, or if you're standing at line at the store, anytime when you're standing for a long period, that's a good time to practice that exercise without having to add additional time exercising to your day. So that's tip number one. Now, because that forward tilt can pinch on the nerves in your lower back, you want to do things to help decrease that tilt. And one is that pelvic tilt exercise that I just showed. But if your hip flexors are stiff, they pull your pelvis forward, and they can also create compression on your lower back. And so it's a good idea also to stretch out those hip flexors. Now, one way that you do that is by staggering one leg forwards and one leg backwards. Then kind of roll the pelvis under like we did in the previous exercise, and then push your pelvis forwards just till you feel a little bit of a stretch right here. And you don't want to go as far as you possibly can because you can see how that arches your lower back more, which counteracts the point that you're trying to do in the first place. So you want to roll the pelvis under and then just push the hips forward until you feel a little bit of a stretch in the front of this leg. And hold for about a minute. So that's the second exercise. Now, I mentioned earlier that after you roll your calves with the rolling pin, it's a good idea to stretch them out. And one way that you can do that is by staggering your feet like this, keeping your heel on the floor. It does help to keep your arch domed on both feet, so you don't want to let your arch flatten down. Keep the arch lifted, toes pointed ahead, and then just lean forward. Again, it's really important that you keep your heel on the floor and not let it lift up like that. Now, you may notice that this position looks very similar to the previous exercise, the hip flexor exercise. So if you're someone who wants to be efficient and try to kill two birds with one stone, you can push your pelvis underneath of you. Again, maintain the heel on the floor. You don't want to let the heel come up like that, but start by doing the calf stretch and then just push the hips underneath of you while having the pelvis rolled till you feel a stretch here and also there in the back of the calf. And so that can save you a little bit of extra time if you want to try to do both of those exercises at the same time, or you can do one where you stretch the hip flexor like that and then do the calf separately. Either option works. So that's the calf stretch. The next exercise is actually a strengthening exercise. So we just stretched the hip flexors and the calves, but now we want to strengthen the glute muscles. Now you actually have three different sets of glute muscles, your gluteus maximus or your butt muscle in the back. And when you're doing the pelvic tilt like that and the hip flexor stretch, you kind of use that muscle to help extend your hip or bring your hip back that way. So this next exercise is going to work on the other two gluteal muscles, which are your gluteus medius and your gluteus minimus. They sit over the outer side of the hip and they help balance you when you're on one leg. So they don't let you tip over to the side that way or let your knee rotate inwards. That can cause problems both locally at the knee, causing the knee joint to twist, as well as if your leg's twisting in this way every time you take a step, it can take the piriformis muscle in the back of your hip and stretch it tight over the sciatic nerve, which can then be a source of pain referring down. So to strengthen the gluteus medius and the gluteus minimus muscle, just practice standing on one leg, ideally in front of a mirror where you can see that your pelvis is level, and try to keep yourself as still as possible. If you need to hold on to a chair or a wall or something for balance so that you're not wobbling, hold on with a finger or two, however much you need to maintain your balance and stay safe, and then try to decrease over time how much you need to hold on. And ideally work up to being able to do that for 10 seconds, 10 times. The ability to stand on one leg for 10 seconds dramatically decreases your fall risk as you age. And so it's a good idea to practice being able to do that anyway. Now, the last long-term treatment strategy is to address your walking pattern. And if you take really big steps like that when you walk, then your back will tend to arch. Additionally, if you overpronate your feet when you're walking, that brings your hip inwards, overstretches the sciatic nerve, and causes twisting locally at the knee. And so you want to address your walking by taking slightly shorter steps and keeping your trunk leaned forwards. That will help both open up the spaces in your lower back where the nerves come out. It also means you don't have to stand and balance on one leg as long if you're not taking as long of steps. And that prevents the side-to-side twisting at your knee and at your hip. Now, I do have another video that goes more in depth on how to improve your walking so that you don't flare things up as you're walking for longer periods. And I'll link to that video right over here. But before you go, if you found this video helpful, then give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.